What if I told you that adding just 3 minutes to your daily shower could dramatically improve blood flow, support cardiovascular health, and enhance physical function without medication, supplements, or fancy equipment? Sounds almost too good to be true, right? But the science behind this technique is solid, and I've seen it work for countless men over 50 who thought their best days were behind them. The best part? You can start today, literally, after watching this video. Before we go further, do me a favor, hit that like button and drop a comment telling me where you're watching from. I want to know who's taking their health seriously today. Here's the thing most men don't realize. Healthy physical function isn't just about hormones or anatomy. It's about circulation, whether your blood vessels can dilate properly and deliver adequate blood flow when you need it most. I'm Dr. Jocelyn, and I've spent 5 years helping men understand exactly what's happening in their bodies. One of the most powerful, underutilized interventions I know, contrast hydrotherapy more simply, alternating hot and cold water in your shower. This technique has been used in sports medicine, physical therapy, and recovery protocols for decades. It's not new, it's not trendy, it just works. Here's the basic principle. Cold water makes your blood vessels constrict. Warm water makes them dilate again. That repeated constriction and dilation acts like a workout for your vascular system, improving endothelial function, the ability of your blood vessels to respond quickly and efficiently. And better endothelial function means better blood flow everywhere in your body, including where it counts most for men. Why haven't you heard about this? Because you can't patent cold water. There's no profit margin. But the research is there, and the results speak for themselves. Today, I'll teach you the exact 3-minute shower protocol that optimizes blood flow, explain why it works biologically, and show you 3 additional habits that amplify the results. Stick with me until the end, and I'll also reveal the one common mistake men make that can be dangerous if ignored. All right, here's the technique called contrast shower therapy broken down step by step. Step 1. Start your shower as usual. Warm water, comfortable temperature. Wash, relax, get clean. Take your time. This isn't about rushing. Step 2. At the very end, turn the water to cold. Not freezing, but definitely uncomfortable. Stand under it for 30 seconds. Yes, it's uncomfortable. Yes, you'll want to jump out. But stay. Breathe deeply. Focus on the sensation. Step 3. Turn the water back to warm, not hot, for 60 seconds. Let your body relax and soak in the warmth. Step 4. Cold again, 30 seconds. Stay present. Focus on your breathing. Step 5. Finish with warm water for 60 seconds. Total time, about 3 minutes. 2 cycles of cold-warm contrast. That's it. Simple, right? But now let's talk about why it works biologically, because understanding the mechanism makes it easier to commit to doing it. The biology. When cold water hits your skin, your sympathetic nervous system kicks in. Your blood vessels constrict, vasoconstriction, pulling blood toward your core. Then, when you switch to warm water or step out and your body warms up, vasodilation occurs. Blood vessels open wider than before. Blood rushes to the surface, delivering oxygen and nutrients. Repeated cycles train your vessels to respond better. Over time, your endothelial cells produce more nitric oxide, a molecule that signals blood vessels to relax and widen. Nitric oxide is critical for physical function. It's the same pathway that medications for male function work on, but here, you're activating it naturally. The benefits don't stop at blood vessels. Increases circulation throughout your body, boosts mitochondrial energy production, activates brown fat for metabolic health, reduces systemic inflammation, supports immune function, improves mood and mental clarity. One of my patients, 58, started doing this every morning. 2 weeks later, he said, I feel more awake, more energized, and yeah, things are working better. 3 months later, his morning function returned consistently for the first time in years. That's not magic. It's your vascular system responding to a stimulus it was designed for. To maximize the benefits of contrast showers, pair them with these 3 habits. Habit number 3, walk for 20 to 30 minutes after your shower. Exercise immediately after contrast therapy amplifies vascular responsiveness. Biology. Muscle contractions push blood through your veins. Your heart rate rises, and nitric oxide production continues. Emotionally, it's invigorating. You feel alive. Practically, a simple neighborhood walk or light stretching works perfectly. Example: A 62-year-old patient combined his shower with a morning walk. He said, "This routine has changed my entire day. I have energy I haven't felt in years." Habit number 2, eat nitric oxide boosting foods daily. Support your blood vessels through nutrition. Leafy greens, spinach, kale, arugula, beets and beet juice, citrus fruits, pomegranate, watermelon, garlic, dark chocolate in moderation, nuts, walnuts, pistachios. Biology. Rich in nitrates and L-arginine, these foods boost nitric oxide. Combine this with contrast therapy, and your blood vessels get maximum support. Emotionally, you feel empowered knowing you're feeding your body to perform better. Practically, add a spinach salad at lunch, snack on nuts, have beet juice in the morning. Example, one patient reported feeling stronger and more alert after just a few weeks of pairing contrast showers with nitric oxide-rich foods. Habit number 1, practice deep breathing after your shower. Spend 5 minutes doing slow, controlled breathing after your shower. Biology. Activates the parasympathetic nervous system rest and digest, enhancing vasodilation and circulation. Improves oxygen delivery to tissues. Practically, sit comfortably, inhale through your nose for 4 counts, hold 4 counts, exhale through your mouth for 6 counts. Repeat for 5 minutes. Emotionally, promotes calm, focus, and energy. Example, a skeptical patient tried it, then said, "This is when I feel everything come together. I'm calm, energized, and centered." The combination of contrast therapy plus movement plus nutrition plus breathwork creates a holistic approach to vascular health and male function. Here's the mistake men make: staying in cold water too long or starting too cold, especially if you have heart conditions. Why it matters: extreme cold spikes blood pressure and heart rate. For healthy people, fine. For those with uncontrolled hypertension or heart disease, it is dangerous. How to do it safely: start small. 10 to 15 seconds of cool water if new to cold exposure. Gradually increase duration and lower temperature. 30 seconds cold is enough. More isn't better. Stop immediately if you feel chest pain, dizziness, or shortness of breath. Consult your doctor if you have heart disease or uncontrolled blood pressure. Gradual adaptation is key. Safety first. Your 30-day routine. Step 1. Shower. 30 seconds cold, 60 seconds warm, 30 seconds cold, 60 seconds warm. 2 cycles, 3 minutes total. Step 2. Walk or move for 20 to 30 minutes. Step 3. Practice 5 minutes of deep breathing. Step 4. Eat nitric oxide-rich foods daily. Step 5. Do this consistently for 30 days. Track energy, mood, and function. Consistency matters more than intensity. Small, daily actions compound into big results. Your body is adaptable. Your blood vessels can improve. Circulation can get better. You are not stuck. You deserve energy, confidence, and vitality. You deserve to feel alive in your body. If this video gives you hope or clarity, hit that like button, share it with another man who needs a natural, effective solution, and subscribe for more practical, science-backed strategies. Drop a comment after your first week. Let me know how it goes. I read every comment and want to hear from you. Remember, you are not too old. You are not past the point of improvement. Small, consistent actions lead to big results. 3 minutes in the shower is a small price to pay for better circulation, energy, and function. Aging isn't declining. It's intelligent, intentional care for your body. Take action today. You're worth it.